Welcome to Afro Mosaic. We are so glad you're here for Series 10 of our 52-week global journey, and this week we're focusing on the Netherlands. Now, our mission across this entire series is to trace the path of health from birth all the way to 100-plus years. We look at everything: health and wellness, legal realities, social systems, and economic opportunity. Our whole goal is to take complex research and translate it into real protective knowledge for communities across the Black diaspora. Today, we're diving deep into a powerful and often silent connection, the one between mental health and cardiovascular risk for Afro-Dutch, African migrant, and Caribbean diaspora communities.
So, let's start with this interesting contrast. On the one hand, the Netherlands is celebrated, and rightly so, for having one of the most robust healthcare systems in all of Europe. Its reputation is one of top-tier quality and equality. But on the other hand, if you talk to many migrant and diaspora communities living in cities like Amsterdam, Rotterdam, or The Hague, you hear about a different reality. It's a story of hidden health pressures, the kind that quietly build over time, creating this gap between the system's promise and their actual lived experience.
And that brings us to the big question we're tackling in this explainer. When the official numbers, the national statistics, seem to show that everything is pretty stable, but the day-to-day experience of a community tells a completely different story of constant stress and health challenges, what on earth is happening in that gap? How do we explain that massive disconnect between the data and the reality of people's lives?
To even begin to answer that, we have to start at the human level. We need to understand the lived reality of these mental health pressures. We're calling it the weight of daily stress.
This quote right here, it just grounds our whole conversation in a real human moment. It comes from a man who is of Dutch background, describing the absolute ordeal he and his wife, who is of Caribbean background, went through just to get her a cancer diagnosis. Her very real pain was dismissed as just being dramatic. Think about that. This isn't a statistic. It's the experience of not being seen, not being heard, and not being taken seriously by the very people who are supposed to help.
You know, experiences like that one, some big, some small, they all add up. And that is the invisible weight. It's not about one single bad day. It's the cumulative burden of chronic stress that piles on from navigating a world where you might be constantly misjudged, dismissed, or excluded. And over time, that weight has a profound physical effect on your well-being.
And this stress isn't some abstract idea. It comes from very real, specific sources. Research consistently points to this pattern of stressors, things like facing discrimination and social exclusion, the constant worry of finding secure work or stable housing, the enormous challenges of migration itself, and, on top of all that, navigating cultural barriers that can make it incredibly difficult to even think about asking for mental health support.
And this lived experience, it absolutely shows up in the data if you know where to look. Studies done in the Netherlands found that people from minority backgrounds report significantly higher rates of depressive symptoms. And a key reason why is that about 19% of that difference can be explained by a lack of what researchers call social capital. In simple terms, that's just not having those strong support networks and a true sense of belonging. The invisible weight has a very measurable impact.
So how does this emotional and mental weight actually become a physical reality? Well, it doesn't just stay in the mind. It triggers a biological chain reaction, a pathway that leads directly from the mind to the body, and specifically to the heart.
Let's just break down how that happens, step by step. First, those constant stress signals put your body's alarm system on permanent high alert. Second, this triggers a relentless release of stress hormones, especially cortisol. Third, over a long period of time, these hormones lead to widespread, low-grade inflammation all through your body. This is the kind that puts an incredible strain on your heart and blood vessels. And the final step? A dramatically increased risk for serious diseases.
And the outcome of that whole biological process is visualized right here, and honestly, this data is just stunning. Research from Amsterdam UMC shows that women of African descent living in the Netherlands have a 5 to 10 times higher risk of high blood pressure compared to ethnic Dutch women. I mean, to put that into perspective, picture 10 women in a room. For every one ethnic Dutch woman who might have hypertension, there could be as many as 10 African women facing that exact same condition.
And here is the crucial point. High blood pressure is not an isolated issue. It's really the gateway to a whole cascade of related health risks, including a much higher chance of having a stroke or developing heart disease. It's also connected to other metabolic problems. The very same research shows that diabetes is 3 to 6 times more common across all ethnic minority groups compared to the ethnic Dutch population.
Okay, so this leads us right back to our central puzzle. If the risks are this high and the disparities are this clear, why isn't this a 5-alarm fire in the national health statistics? Why isn't the full story showing up? Well, this is where we have to look at the system's blind spots.
A key concept to understand this is something called race evasiveness. It's a term researchers use to describe a tendency, especially in many European countries, to avoid acknowledging race and racism as factors in society. Now, the intention might be to promote a colorblind ideal, but the actual effect is that it makes it impossible to see, to measure, and to fix inequalities that are, in fact, driven by race.
And you can see this play out directly in how data is collected. In the Netherlands, official systems often use these really broad categories, like person with a migration background. Now that might seem neutral, but what it does is it lumps together incredibly diverse groups of people, from Suriname, from Ghana, from Morocco, from Indonesia, as if their experiences, their cultures, and their health risks are all the same. This can completely mask the very specific health problems affecting one particular community.
And on top of that, there are all these other factors creating this data gap. We see underreporting of mental health issues often because of cultural stigma. People might delay seeking help, so problems don't even get recorded until they become a full-blown crisis. And even when people are treated for things like high blood pressure, studies show that their blood pressure isn't as well controlled and they're more likely to stop taking their medication. All of this just widens the gap between what's really happening and what the official numbers show. So, understanding the problem is the critical first step, but the whole goal of Afromosaic is protection. So how do we start building a healthier future? What we need is a blueprint for prevention that tackles these interconnected issues head-on.
And that blueprint really rests on 4 powerful pillars. First, early and regular cardiovascular screening, aimed specifically at communities we know are at high risk. Second, we need culturally responsive mental health care, with providers who actually understand the community's context. Third, we need community-based awareness programs that are run by trusted local leaders to build that trust and share knowledge. And fourth, and this is so important, a huge shift in mindset towards early intervention, getting ahead of the problem before serious symptoms ever show up. And that right there is the key takeaway for protection. True prevention cannot be reactive. It's not about waiting for someone to show up at the hospital with chest pains. It has to be proactive. It starts years, even decades earlier, by recognizing the unique risks tied to chronic stress and then systematically building trust between communities and the healthcare system that is meant to serve them.
Let's just zoom out for a minute, because what we're seeing in the Netherlands isn't just a Dutch story. It's a really powerful case study with a lesson for any nation that prides itself on having a strong, universal healthcare system.
And it really gets to the core challenge, doesn't it? Even the best resourced, most well-intentioned systems can fail their communities if they aren't measuring the right signals. A system can look perfectly healthy on paper, based on national averages, all while completely missing the deep currents of stress and risk that are pulling specific populations under.
The path forward is actually quite clear. If we want to close that gap between a system's reputation and the reality for all its citizens, it takes a 3-part strategy. We need better, more specific data. We need to engage deeply and authentically with communities to understand their experiences. And we have to shift the entire focus toward earlier, more targeted prevention.
Which leaves us with one final provocative thought to chew on. We've talked a lot about data gaps and blind spots, but is the fundamental challenge really a lack of information? Or is it a lack of recognition? A failure to truly see, to hear, and to value the lived experiences of every single person the system is supposed to protect?
For so many who have migrated and built new lives around the world, survival was the first victory.
Protection is the next responsibility, and understanding these powerful connections between stress, our health, and the systems all around us is exactly how we build that protection for the next generation across the entire global Black lifespan journey. Thank you so much for joining us for this vital conversation.